In the south tomorrow, with isolated light showers most likely during the morning and early afternoon. Mostly sunny in the north. There's a strong wind warning for the East Gippsland coast tomorrow. For Melbourne, partly cloudy and a top of 19 degrees tomorrow. A slight chance of a light shower in the morning and early afternoon. On 19 degrees. And it's looking partly cloudy for the rest of the forecast period, Wednesday 21, Thursday 22. ABC News.
ABC Radio Melbourne traffic.
Hello, Dan Belling from the Department of Transport. There's delays through the Westgate interchange onto the M80 Ring Road, Greensborough bound. A collision at Boundary Road has been shifted out of the running lanes for fire crews still in the left-hand emergency lane there. Watsonia got a collision on Grimshaw Street eastbound before Greensborough Road. The left lane is blocked. Ferris Road in Melton, it's closed in both directions at the level crossing due to emergency signal repairs. Best to use the Exford Road level crossing instead. It's heavy in the area. And in Braeside, slow going on Springvale Road southbound towards the Mornington Peninsula Freeway. Got a lane closed near the freeway entrance as part of upgrade works. Congested from Cheltenham Road. Allow some extra time. If you notice anything on our transport network, call 1300 222 774. That's the latest Melbourne traffic.
You're with Raf Epstein on ABC Radio Melbourne.
Welcome on the ABC Radio Melbourne website and on the ABC News YouTube channel. Facebook, who needs them? Let's talk about vaccines, because the only way you can fight a virus is to use a vaccine. We've got access to 3 of them. Only 2 of them have been approved so far. Is it the right strategy? When can we all relax? When are you all going to be able to say, hey, I think this thing is kind of over? I don't think you're going to get a solid answer to that question. But if you do have them, 1300 222 774. Professor Sharon Lewin is joining us from the Doherty Institute. She is genuinely one of the best medical research minds in the country. And seeing as we've done a hell of a lot better than countries like Britain and America, I think we can place her in the top rank. She is definitely good at making complex things simple. Now I've given her that boost, let's welcome her to the show. Sharon Lewin, thanks for having a word to us.
Pleasure to be here, Raf.
I'm getting so familiar with the backdrop, with the shelves. We've never actually physically met, and we've had tons of conversations. That's okay. We have started to roll out for frontline people and people in aged care homes the Pfizer vaccine. What difference do you think that's going to make?
It's going to make a huge difference, because what these vaccines do, the Pfizer and also other vaccines Australia's purchased, is have a fantastic impact on eliminating severe disease. So basically, if you caught COVID, you would no longer get very sick or go to hospital. And so rolling it out into aged care homes and including the people that work in those areas and disability areas with disability as well, means that people in these very vulnerable groups, that should they be exposed to COVID, of course we've got no COVID community transmission here at the moment, but should we have COVID entering our community again, or another time of spread through the community, these people are protected from getting very sick. Really, really important. At the same time, also vaccinating our frontline healthcare workers and people working at the borders and in quarantine. And that's really important, because that's our weakest point for entry of COVID into Australia at the moment. And these vaccines also reduce the likelihood of just getting infected.
I know we're speaking in a realm where we don't have the normal science we can rely on, double-blind tests in laboratories, peer-reviewed literature. But is it looking more and more, especially with the frontline workers, does it look like these vaccines will stop people passing the virus on?
Yeah, so just to step back a bit, so because we do have these big studies, it's really important to remind people that the vaccines we're using have been used in double-blind peer-reviewed, double-blind massive clinical trials with clear endpoints and now published and reviewed extensively by our regulators. So the first thing is that the vaccines definitely reduce the number of people with what we call symptomatic COVID, people that have a positive swab in their nose and also have symptoms. And the Pfizer vaccine that we're talking about reduces that by 95%. At the same time, it reduces effectively 100% severe disease. This is really, really good. Now, there's a small number of people that may well have asymptomatic carriage of COVID. I mean, they could still carry the virus, but they're not going to get sick from it or have any symptoms. And that's the group that we don't have all the details on yet. But the preliminary evidence suggests that the total number of people that will be positive for COVID is reduced by the vaccines. The amount of virus in their nose is lower. We know that now from both the Pfizer study and the AstraZeneca study, and the duration that they would even be positive. So all of that augurs well for reducing transmission.
Yeah, sorry, I did mean we don't have the science on the transmission, not on the science of the effectiveness of the vaccine. When can I breathe out? When can I relax? Like, is that now? As soon as everyone at the border's vaccinated? Like, when are you going to go, whew, we're okay?
Well, I'm going to share a secret with you. I'm feeling pretty good about being in Australia right now. Very much. I mean, we're doing really well. I think we lose sight a bit of this in Australia because because how we're living in Australia is unlike any other place in the world except New Zealand, I'd say. So I'm quite relaxed right now. But of course, life is not normal. And of course, we know that there's always this chance that there could be an incursion of the virus and spread. So when will I feel relaxed? I'm very happy about our frontline workers, particularly in the hospitals and our airport workers and border control, because that's where we've seen these transmission events happening. And by having people vaccinated, it will greatly reduce the chance of transmission events happening again. And it also means that these people that have really put their lives on the line by doing this sort of work, of course, with maximum protection for all of them, we hope, they're going to be protected. They're not going to land up in hospital because even young people we know have a small risk of getting really severe disease. So I think that's great for the frontline workers and our aged care. And I actually will feel already very happy after phase 1A. I felt happy already today, to be honest. I thought it was a momentous event to see it all roll out. Even though we're much later than many countries, it was just wonderful to see the vaccine roll out today. So phase 1A, I'll be pretty happy. When will our lives really go back to normal? That's going to take a lot longer, I'll be honest, because we need a substantial number of our population vaccinated. And then we also have to really understand what large-scale vaccination is doing to transmission. And eventually a way out of here is that we move COVID from being an infection that can kill you or lead to hospitalisation, particularly if you're elderly, to an infection that just causes the common cold. I don't think we will eradicate COVID at this stage of the game, but we can move it from being something we really worry about and contain every single case to an infection that just becomes like the common cold. And I do think that's possible.
Have we placed too many bets on one vaccine? Most Australians will get the AstraZeneca vaccine. Is that a sensible strategy?
Well, actually, the strategy for Australia is to have multiple platforms because, remember, we're going to keep on getting information about these vaccines as they roll out. Pfizer vaccine, 20 million doses, that's 10 million people. That's half the Australian adult population, I guess, because we're vaccinating
Is it
adults
20 million
to start with.
doses total or 10 million doses total?
20 million doses, 10 million people. AstraZeneca, we can manufacture here, which is great, which means that we are not dependent on changes in the supply chain, which is always a vulnerability, and a plan to manufacture 50 million doses, and then a deal with Novavax. That's one that people may not know as much about. It's more of a routine vaccine, meaning it's a protein vaccine, one that we're a bit more familiar with. A little bit trickier to make, actually. So the supply chain may not be as quick as we would like. We're still learning about that, but it looks really good in the studies, about 90% efficacy.
There's a lot of people, I know there's disagreement between different experts. There's no doubt I will take any vaccine I'm given, and I'm certainly advocating. I think that's a great idea. But there's a lot of experts saying you can't knock the virus on the head with just the AstraZeneca and the Pfizer. The AstraZeneca is not effective enough. Is that a valid criticism?
I think it depends. No, I don't actually think it is. Certainly, if you line them up head to head on a league table and measure one thing, which is symptomatic COVID, AstraZeneca, Pfizer reduces the number of people with symptomatic COVID by 95%, AstraZeneca between 60 and 80%, depending on how you received your vaccine. So that's just one way that we measure how effective a vaccine is. The second and most important way, at least for us in Australia, is how effective is it at producing severe disease, requiring you to go to hospital and potentially leading to death. Both of them reduce that by 100%, really good on effectiveness. And the final thing is, how good is it in reducing transmission? And that's going to depend on the total number of people that carry the virus, how much virus is in the nose, and how long you shed it for. And the data actually coming out on AstraZeneca looks quite encouraging. And that third bit is more the community effects. So I think as an individual, if I had AstraZeneca or Pfizer, I'm going to get complete protection from severe disease, which is what I care most about. And I will be contributing to the larger pool of people that are going to be vaccinating to overall reduce the amount of virus that's circulating in our community, heading towards what some people call herd immunity. So I think on an individual level, I'm quite comfortable with it. There are a few unknowns for both vaccines, all of the vaccines. We don't know how long immunity is going to last.
Well, AstraZeneca doesn't deal well with the South African variant, that sort of thing, and it's harder for it to adapt to different variants. Is that a weakness with that option?
You're exactly right. We're worrying about these new mutants, or what we call variants of concern. Everyone knows. I don't like calling it the South African variant because it probably is in many countries. They just haven't looked for it, but first described in South Africa. And yes, all of the vaccines don't work as well against the South African variant. And how do we know that? We collect blood from people that have been vaccinated, and we test whether the blood can control the different variants in a test tube model. And the South African variant is a little bit more resistant to killing than the original strain of COVID. Now, we don't have any clinical data yet on the mRNA vaccines and how they fare against this variant that was described in South Africa. I'd predict they will do okay, but we don't yet have that clinical trial results. We do have some clinical trial results on the South African variant, on a trial done in South Africa on AstraZeneca, but it's important to realise, very small study, 2,000 people, done in young people, and only looked at mild infection. So we don't yet know the answer of how good the vaccine is against preventing severe disease of this variant. And we know from Novavax that the efficacy was certainly reduced in a clinical trial. It was about a third less powerful in South Africa than it was when it was tested in the US. Yeah.
On the ABC News YouTube channel, on the ABC Radio Melbourne website, we are live streaming. You are listening to Professor Sharon Lewin. She's the director of the Doherty Institute. And of course, I suspect most of you who are listening to this, you're listening on the radio, ABC Radio Melbourne, which is the radio station that is delivering this to you, and delivering Daniel, who's called from Mulgrave. Daniel, what did you want to ask?
The question I have, is the AstraZeneca a DNA vaccine?
You mean, is it an mRNA vaccine, or are you asking if it changes your DNA?
Not an mRNA, a DNA vaccine, which is another type of vaccine you can have.
Go for it, Sharon. Go for it.
The AstraZeneca is not a DNA vaccine. It's what we call a viral vector vaccine. It's made from a form of cold virus that infects chimpanzees. So as a human, you've never been exposed to this sort of cold virus, and then it carries bits of the coronavirus to allow you to make an immune response. So it's what we call a viral vector vaccine. But great question. And clearly, Raf doesn't know about DNA vaccines. I love that RNA vaccines has become so familiar to people. They're actually really new and novel science. But you're exactly right. There is another form of a vaccine very similar to the RNA vaccine, which is a DNA vaccine. And there are some DNA vaccines being evaluated for COVID. We don't have any results yet.
Heather's in Diamond Creek. What did you want to ask, Heather?
Hello, Raf and Sharon. I've previously had an anaphylaxis. It was a very serious anaphylaxis, and I've heard that people that have had a history of anaphylaxis should not have a vaccine. Is that apply to both of them, or is there one I can have or a future one I can have?
I don't know if you feel qualified to answer that one, Sharon.
Yeah, no, I'm good with that. The recommendation is if you've had anaphylaxis to the actual vaccine or any known component of the actual vaccine, is to not have the vaccination. This is just with the Pfizer vaccine. If you've had anaphylaxis for another reason, and people can get anaphylaxis from peanuts, for example, or shellfish, or even an unknown allergy, you can still receive the vaccine, but you need to stay under observation for a little bit longer than the standard 15 minutes.
What's in them, Sharon? Like just the Pfizer vaccine and the AstraZeneca vaccine. What are the substances that are in them? I mean, is it like sugar and fat? Like, what are they made of?
Well, the core component of the Pfizer vaccine is, of course, the little piece of RNA, which is the genetic code of the virus wrapped up in a lipid particle. And then it's suspended into a solution. And in that solution, there are some chemicals which are all listed out. And some people can have I don't know the list of the chemicals, but some people can have an allergy to those chemicals. The AstraZeneca vaccine, as I mentioned earlier, is a form of the cold virus that infects chimps, not humans. And it also is suspended in liquid. So the anaphylaxis from the AstraZeneca vaccine has not been described. It's only with the Pfizer vaccine.
Okay, we'll come back with Professor Sharon Lewin, but let's just get some traffic.
ABC Radio Melbourne traffic.
Hello, Dan Belling from the Department of Transport. Delays through the Westgate interchange onto the M80 Ring Road Greensboro bound. The collision at Boundary Road has now been shifted out of the running lanes, but do pass with care. Watsonia collision on Grimshaw Street. It's eastbound before Greensboro Road. Do take care coming down the hill after Watsonia Road. These cars blocking the left lane. And Ferris Road in Melton. It's closed both directions at the level crossing for emergency signal repairs. Use the level crossing at Exford Road instead. There's delays in the area. If you notice anything on our transport network, call 1300 222 774. That's the latest Melbourne traffic.
You're with Raf.
Professor Sharon Lewin's director of the Doherty Institute. It's almost 22 minutes after 5. The third vaccine you mentioned, Sharon, just before we get to some more questions, the Novavax vaccine. Do we know when it's coming, and do we know if we are able to make that vaccine in Australia?
I don't know when it's coming, and we at the moment are unable to make that vaccine in Australia. It's a protein vaccine which is similar to many of the vaccines we have, but it has a special component to it. We call that an adjuvant, which basically gives a kickstart to the immune system, and the adjuvant's a little tricky to manufacture. At the moment, we're not manufacturing it in Australia.
And we could, or we're not? I just wonder, like, is it a whole new world, and $1 billion, or it's just you buy the right machine, spend a bit of money, and you can do it here?
I can't comment on that. I understand from CSL it's a tricky one to make. That doesn't mean we can't, but at the moment I understand there's no plans to make it in Australia.
Okay. Jack is in Clyde. Jack, what's your query?
Hi, I just came from the physio today, and his girlfriend contracted the virus last year, and 8 months later she didn't have to go to the hospital to just isolate. She's suffering from long-term health complications with fatigue.
So she's got long COVID, does she, Jack?
It was about 8 months ago that she caught it.
Yeah. And what's your query, Jack?
My question is with the vaccines. The lady said that even if you don't contact her, that if you do contact her, it reduces the severity of the virus. But what about the long-term health complications that the virus gives you? Does it reduce that as well?
Sharon, we had some amazing calls into Virginia's show about people who are suffering from long COVID. Does the vaccine stop you getting that?
Really great question. We don't know. There's no studies yet to look at the effects of vaccination on long COVID. We do know that long COVID is a really big problem, absolutely. Estimated about 15 to 20% of people that have COVID can get long-term complications, even if you have mild infection, though long COVID is more common if you've had a more severe initial disease. We don't yet know the effect of vaccines on long COVID.
And Sharon, I get so many detailed questions about people who are immunosuppressed, their transplants. If you've got a worry, who do you ask?
Oh, definitely you need to chat with your doctor, especially if you have other underlying health conditions. Both the Pfizer and the AstraZeneca vaccine have been tested in very large numbers of people, but in the big studies, there were not large numbers of people with underlying immunosuppression. However, there's no reason to think that these vaccines are dangerous at all in that group. If anything, they're really important for that group to receive. But best to discuss it with your doctor, who'll be able to give you specific advice. We're still recommending that people with other comorbidities or underlying immunosuppression receive the vaccines. The vaccines don't contain live virus, so they're not at all dangerous to someone with a weakened immune system.
Simon's in Rover. What do you want to say, Simon?
Yeah, I've got a question about the long-term strategy. It concerns me a bit that in Australia we're not actually facing a threat directly. Clearly the vaccine's a very good idea at the border, but given that most of us are going to get the second-level AstraZeneca, given that there's going to be ongoing mutation around the world, aren't we better off remaining reliant on our border controls until the whole thing settles down worldwide? Then when we know what we're vaccinating against, we can vaccinate. My long-term concern is that the Chuckle brothers who run the government seem to just simply want to shove a needle in everyone's arm so they can open the borders again and expose us all to future risk.
So I guess Simon is asking there, Sharon, I guess let's wait. Don't go straight holus bolus AstraZeneca. We don't have a lot of the virus. What do you think?
Yeah, no, totally understand where you're coming from here, Simon. I think we're in a really good situation now, and as I said to Raf earlier, I'm feeling relaxed and happy about it. But we are in a precarious situation. We have a leak from a quarantine hotel which spreads within communities. We've seen it happen before, and suddenly you can have a very big outbreak on your hands. This spreads much easier in the winter time, and winter is coming. I know I can't say that without people laughing, but anyway, winter is coming. And I think we do need to get ahead and vaccinate. We have 2 very good vaccines that prevent people from getting very sick. We can make new vaccines that will be made against the variants. Actually, we do that every year with influenza. Every year, a brand new influenza vaccine is made depending on what the circulating strain is. So I think to have that protection now with a vaccine that we know is safe, is free, should be easy to get, will really be a benefit to the broader community. It seems like we don't have anything to worry about, but actually we really are in a situation in Australia. It's a great situation to be in, but it could change very quickly. So I'd like to get my vaccine now.
The 1 jab or 2 jab debate, can you just explain which of them is 2, which of them is 1, if any? And does it matter? Can you mix and match? Can you just explain how that all works?
Yeah, all of the jabs, all the vaccines are 2 jabs. They're spaced at different intervals, except the Janssen vaccine made by Johnson & Johnson, and that's a single-dose vaccine. And that also looks very good, and many countries are using the Janssen vaccine. The 2 doses for Pfizer is spaced out by 3 weeks, and with AstraZeneca, the initial studies looked at between 4 and 12 weeks, and it looks like 12 weeks gives you a better response, and that's the recommendation in Australia by the TGA to space it out 12 weeks. Could you get away with 1 dose? Well, actually, the UK are doing that because they've got a major issue on their hands with overwhelmed healthcare systems and a real need to get vaccines out quickly. And they've gone for vaccinate more people with 1 dose and then give the second dose a little later. The US are not using that at all. They're just using what was proven in the clinical trial. And my view is we should go with what was proven in the clinical trial, especially in a country like Australia where we don't have this real urgency that we have to vaccinate people within the next few weeks. There is some really interesting information coming out that people that have had COVID before do really well in their antibody responses after just 1 vaccine. So in countries where there's lots of COVID, they might get away with a single vaccine.
And is that because their body's already got a whole lot of the antibodies that your body generates, therefore the 1 jab's more effective?
Exactly, yeah. Your immune system works, we call it when you're trying to develop a good immune response, you prime the immune system, like give it its first exposure, and then you give it a boost to really have a great immune response to a pathogen. And so that's why you basically have 2 vaccines. The first one's priming, getting the immune system revved up, and the boost really amplifies it. And it looks like if you've had COVID before, it does the priming, and then you come in with the boost. Oh, you also asked Raf about mixing the vaccines. We don't yet know the answer to that. theoretically, yes, mixing vaccines may not only just be effective, and may only just be safe, but it could be much more effective. And those studies are now happening actually in the UK, mixing Pfizer and AstraZeneca.
Final question. I've got to get to some news headlines. When was the last time you were in a queue, or what was the most memorable moment you had in a queue?
Well, I was thinking about this. I'm very impatient and very rarely queue for anything. I never queue for food, that's for sure. Probably the last time was when I was last in an airport, when you've actually got no choice. So it's been quite good not queuing for a while.
Okay. Thanks so much for your time. Thanks for your work.
Pleasure. Thanks a lot.
Professor Sharon Lewin, Director of the Doherty Institute. You have been watching us on our ABC Radio Melbourne website and on the ABC News YouTube page as well. We've put in a ton of requests, by the way, over the last few months to have a word to the gaming minister in this state. As I've been saying, we've spent quite a few years with allegations swirling around Crown. Today...